What will new patients solve for you? That's a question that I ask clients. And they tell me all sorts of things. They tell me if I had new patients, my practice would be much bigger. If I had new patients, I'd be making more money. If I had new patients, I'd have the money to be able to go on vacations with my family. If I had more new patients, I'd actually have more money to be able to hire an associate, which would give me time to be at dinner with my family. If I had more new patients, I'd be able to hire more staff. If I had new patients, and it goes on and on and on. They give me all reasons why if they had new patients, they could do all these things. So of course, my next logical question I ask is, have you ever had new patients before? And they kind of laugh at me and they say, of course I've had new patients before. And I'd say, well then why didn't that solve your problem? Why don't you have all the money in the world? And then they think about it for a minute and they go, well, they were the wrong types of new patients. They weren't the type of new patients that I thought they would be, or they weren't exactly what I needed, and they give me all the reasons why all the new patients for all the years before now were not quite the right new patients, but believe that new patients is actually the problem. So I say this, there's either one of two problems going on. Either one, in the past and even in the present, they actually have enough new patients. They just don't know how to manage their new patients, which means they don't have the staff required to call the patients, to respond to Facebook ads, to actually get the patients to arrive in the practice. And in earlier videos, we talked about that. Or number two, which is very common, is they don't have a new patient problem. They have a conversion problem. Let me tell you a little bit about flow, conversion, retention.